Some parameters and guidelines for injections. This is our injection testing time for this afternoon, and we've got 10 students here, and we'll practice a lot. We're going to practice sub-Qs for heparin and regular and NPH insulin. And I think the student group didn't have any questions, did you, about sub-Qs or injections? We're pretty clear. I'm going to try to cover as much as I can. We also need to cover some information about doing IMs, Demerol and Vistaril combination. I'll remind you that Demerol and Vistaril is not commonly done this way as much anymore. We use a lot of IVs and PO meds for pain, and also patches. We use a lot of those, as well as IV therapy for pain meds. But we're going to have you practice that today, but not test on it. All right? The testing only involves giving one sub-Q injection to Mr. or Mrs. Pillow, which you have in front of you. That's your patient for today. So we're going to practice using the calculations, the formula, so you know how to do that in case you haven't practiced that in a while. The formula, we call it the formula, is desired over had times quantity. Desired is your doctor's order or what you want. What you have is what the pharmacy has supplied you in your box or your bottle or whatever you have in front of you. And the quantity is what it comes in, like 1 tab or 1 mil or 2 mils, something like that. So let's do this Demerol Vistaril thing. I do have to have the students talk to me for the numbers, if that's okay. Good. The order here is Demerol 50 and Vistaril 25. We're going to put that in one syringe. I am now, not stat, but now. That gives you a moment, just a moment longer to get it put together. And Demerol 50 is the order, so you have to tell me, somebody, one person please, would tell me what your Demerol bottle says that you're using today. What is the content? What do you have?
100 milligrams per milliliter.
Okay, so we desire 50, right? And what is that, Tracy?
100 milligrams.
We have 100 milligrams per 1 ml. Okay, that's how you work it. The idea is that the milligrams cancel, gives you your answer in milliliters, and that's what we want. Okay? It's real important you know that quantity because it may be 2 mils or 5 mils or some other kind of quantity. So when you work this out, what do we get? Somebody tell me, one voice? Somebody? What is this? Okay, so 1/2 or 0.5 mils. I will remind you that in this, of course, we teach you to put leading zeros, always and forever, all right? If there's a decimal, it's always a leading zero. So we're going to draw 0.5 of the Demerol. Now, Vistaril, we've been ordered to give 25 milligrams. Somebody tell me what's in your bottle for Vistaril, please?
100 milligrams per 2 cc's.
Okay, and I think that's what everybody has, right? Is that correct? If I'm not mistaken, it's a generic bottle. Okay, 100 milligrams of Vistaril.
Correct.
In how much?
2 cc's.
Aha! And we're going to change that to mils because that's what we're trying to teach now, and it's so hard for all of us old nurses to remember that we got to get cc's out and milliliters in. All right, so you see how important that is to not assume it's one of something. Makes sense, does it not? So let's take this down. And that gives us how much when we work it out? Same thing. Boring, right? So in your calculation, perchance you'd have to do that. You have 0.5 of Demerol, 0.5 of Vistaril to equal a total in the syringe of?
1 cc or 1 ml.
1 mil. It's hard, isn't it? Yeah, I know. I can't quite get the mils coming out. All right. Everybody okay with that? So you're going to practice that actual problem at your station, please, if you will. All right, heparin, 5,000 units. Somebody tell me what, that's the order, tell me what your heparin bottle says. Hopefully you all have the same labels.
10,000 units per ml.
Great, thank you, Bill. So we want to give 5,000 units, right? And we have on hand from our pharmacy supply 10,000 units. Sorry, times 1 mil, right? That's what he told me. So I have to work that out. What does that come out?
0.5.
It's getting pretty boring, isn't it? The 0.5. I made it way too easy. I should have given something bizarre. Okay, so we need to give 0.5 mils. It's hard for students to remember that you're not drawing up units of heparin. Truly, you're drawing up 1/2 mil in which is contained that many units. Because then you start thinking insulin, which you're truly drawing up by the unit measurement. It's very confusing. So be sure, even though the terminology is the same here, it's not the same way the drug is contained in the liquid, in the bottle. So we draw 0.5 mils of heparin, and that's what you would do when you test with me this afternoon, if it was a heparin problem for you, okay? the lab test associated with giving insulin? What do we look for?
Glucose.
The glucose, right? The blood sugar or the glucose. Either a sliding scale or a regular dose. This doctor happens to have ordered this as an AM dose, let's say. How many units total will we have? Right? So that's the calculation, so to speak. It seems simple, but that's what we want you to do. Calculate how many units total. And then we already said that we draw up the fast or clear first. What do we have to do with the cloudy to make sure that it's in good shape? Shake it real hard?
No.
No, because a bubble in there could actually change the difference in units, the difference in how many units you draw up. So you either roll it or edge it up and down slowly. All right? Great. So that's all you would have to do for that. Any other questions can you think? If it's okay, Terry, we'll take questions just individually before you practice a little bit. Yes.
I forgot when you had drawn up your .02 millimeters of air.
Okay, .02. Tracy has a good point. .02 is usually considered an airlock. And we use that sometimes, for sure, when we use Z-Track. Not very often we use IMs. Most nurses don't consider that a big deal anymore. The needles are so fine and thin. For Z-Track, definitely, because you can get all the drug. The idea is that little bit of air pushes the rest of the drug out of the needle into the skin, so you're not dragging it out through the skin. You can remove the needle, but not too often done in regular IMs. Not too often at all. And sub-Qs, no. You definitely don't put an airlock or any extra air in the insulin. You could change the insulin dosing. When you draw up heparin or insulin in most hospitals, what do you have to do to make sure you got the correct dose? What do you do?
Have somebody
Check it with another licensed nurse. That's an RN or an LVN. LVNs are licensed nurses, not an aide, but RN or LVN. Cool. All right. Other questions? That was a good point. Okay, yes, ma'am.
I don't know if you answered this already, but for testing purposes, are we, because I learned my dimensional analysis.
That's absolutely fine. Yeah, you can use formula, dimensional analysis, or ratio proportion, my unfavorite one. Everybody picks one and then sticks with it pretty much. Whatever you're comfortable with, as long as you get the right answer, we're happy to support whatever you want to use. Okay? Because you folks will have a math test. Do you get one as well? Twizzy? Of course. Why am I thinking otherwise? So you do want to get used to doing calculations, even though we don't have to so much in the hospital. Yes, ma'am.
Can you go over putting the air in the insulin?
Sure. Yeah. I'll just mimic it. In fact, she has real small insulin bottles, so I'm going to pull them out like this. Okay? So Terry can see. I won't do it through. I'll just mimic it for you. Okay? So I know my order, right? And I'm just like, I tend to do things on right-handed, so I'm going to put my regular on my right-hand side. That's just me. If you get a system, sometimes it keeps you consistent. And I'm going to wipe off both sides. And then I'm going to draw up how much air I need for NPH and put that in this way, not this way, because I don't want to contaminate my needle. I put the air in, come out, right? Get more air, 4 units, I believe. Put it in, then flip it over, right? Pull out my regular. And it's better, these are really hard to see, the top of that black, so if you pull it past where you want and then go back, it not only loosens the plunger a little bit to make it easier, it doesn't stick, but then you can really eyeball it, because these are pretty small, no matter if you're young or old. It's just hard. So then I take it directly out of the regular, and as long as I haven't turned my back, I don't have to swab this again. I go directly in, pull this up like this, and then I slowly go to my total of 12. I can't push back in, right? And then I recap. We don't scoop anymore. We have to recap now carefully. And then I take my alcohol and my med sheet. So that's the only other thing I wanted to mention before we start practicing is in all the hospitals and in nursing school as well, you must have your med sheet with you as well as your medication. Because how would you check something against the band? You have to have something. So your name and your medical record number should match the patient's armband. Okay, those are the 2 most important patient identifiers. Every hospital requires you to do that. Some also add date of birth, but we really prefer you use the last name, medical record number. If you're not sure, you can ask them more information like date of birth, that kind of thing. Room number, never. We change them so fast, it's impossible to keep track.